Welcome, welcome everyone. We are here on another Thriving Thursday. I am so excited to be here with you all today and to share a little bit more about what I do. So, for those of you all who don't know me, my name is Rashida Hatchett. I am a registered nurse and resilience strategist within expertise in healthcare. And I am here really to talk about something that is on my heart, something that I do on a day to day. And I don't always get on and talk about what that is, but I want to dig into nurse burnout today. So, today we are going to be talking about checking the culture. Your nurses are burnt out. Now what? What do you do now that you found that nurses are burnt out? That's not anything that's brand new to us, right? We've been talking about this since the pandemic hit. And for me, this has been a conversation even before then. Nurses were burnt out before the pandemic. We were in spaces of not being sure that we could continue working the way that we work prior to being in this space of full pandemic. We're on the front lines, taking care of people and trying to keep the world healthy. And sometimes that has been, and oftentimes that has been at the peril of our own health and wellness. So I want to hop on here and just talk about some strategies and some tips that as leaders you can use to help your team right now. Right now, as they're in the midst of, we know we're burnt out. We've moved past burnt out, and a lot of our nurses are suffering from PTSD. A lot of them are in phases of depression and anxiety, having panic attacks. And all of this has been in an effort to save humanity. And while they are sacrificing themselves and putting themselves in harder positions because they are taking care of everyone else. And now it's time for our healthcare system to take care of our nurses. So, one of the things that we know is that nurses are the largest segment of healthcare that we have. We have a vital role in the healthcare system. We are patients' advocates. We're the eyes and ears of our providers. We are the most trusted profession in the world. And the reason is because we're with our patients and we're caring for them so much. They know that we're there. They push that buzzer and we show up, right? So we've begun to be everything that our patients need in this advocacy role to help them through some of the best and the worst of times. And yet, when we're advocating for ourselves to our healthcare system, to the powers that be, we often go unheard. Like we talked about, prior to the pandemic, nurses were burnt out. We were tired of the way that we work, being in a system that is chronically short staffed, not being able to take our vacation time. Many of you might have seen, heard, or been exposed to nurses not being able to get breaks, the amount of nurse bullying that was happening. Brand new legislation around being able to be prosecuted for assaulting a nurse. All of these things that were happening prior to the pandemic that didn't stop once the pandemic hit. In healthcare, we work in what we call organized chaos. We never know what's coming through the door. We never know what one day is going to look like, right? It's always different. They're never the same, but there's a rhythm to it. We kind of know what to do, when to do. Lots of things come at us, and we're juggling them and figuring out how we move and how we navigate through. And what has happened is that our healthcare system has said, hey, this works. Organized chaos seems to be working. While on the other side, nurses are saying, no, it's not. It's never been working. We've just been making do. This has been Band-Aid after Band-Aid after Band-Aid that we've put on these really large issues that need more attention. So here we are in this space of nurses now getting some traction and our voices being heard that we need more. We need something else. We need to prioritize our wellness. We cannot continue to take care of people from this empty cup. We've got to fill our cups up so that we can continue to take care of people. And as we're seeing the shortage in nurses, as we're seeing the mass exodus from people going to their jobs that they had prior to the pandemic, and nurses are included in that, as we're watching this happen, we're trying to figure out, how do we make the bleeding stop? And a lot of us have seen sign-on bonuses. Last week, I saw a sign-on bonus for $40,000. And all I could say is, we are so far past money. We are so far past money. We're past gift cards. We're past water bottles. All of those things that we're doing to say, hey, we appreciate you. We're past that. Nurses are looking for true appreciation, for appreciation of them as a whole person, helping them to create work-life harmony. We're looking for true wellness. So as leaders, as you are looking for ways to retain your nurses, to keep them on, to say, hey, we see you, we hear you, we are making as many changes as we can, I encourage you to start to look at some of these things that I'm going to talk about, right? So I'm going to give you 4 steps, 4 things you can do right now to help combat nurse burnout. And the first one is assess. You cannot fix what you don't know exists. You can't fix what you don't know exists and how it exists within your organization. So checking the culture is really about looking at, how does this show up in my organization? Last November, I did an impromptu survey of about 1,000 nurses, and I said, I want to know where you're at. Are you burnt out? Are you sort of? Are you overwhelmed? Are you far past burnout? And what does it look like for you? Are you wanting to stay with your employer? Are you wanting to leave? Do you fault them for part of what's happening in your life and the way that you're feeling? 58% of those nurses said, I am ready to leave my employer because I'm burnt out. 58%. That's a huge, staggering number. Well over half of our nurses in this very small survey that I did said, this isn't working. Can't work this way. And I followed up and asked some questions about whether or not they had ever been assessed for burnout, if their organizations had ever said, let's see where our nurses are and let's just ask them. And I got a resounding no. Very few had ever been asked or taken any kind of assessment to see whether or not they were living in a place of burnout, and then figuring out what we do about that. As a leader, everything that affects your team is in your sphere of influence. And part of that influence means assessing. It's tough. It's hard to ask people these difficult questions, but it is absolutely vital to understanding where your team is and predicting what your retention rates are going to be. If you know your team's burnt out, 58% of them are burnt out, you can guarantee that you're going to lose some team members. But with that information, you can also make the necessary changes to address what's happening and to create spaces where you can work on prevention. So if you haven't addressed, if you haven't assessed it, if you haven't said, what is this? How is it showing up in my organization? I encourage you to do so. If you're looking for tools, chat with me. Talk about tools and how we do that. Next one is address. Oftentimes in healthcare, we find that we've assessed things. We do needs assessments all the time. And a lot of things come up. And some things are addressed based on the priority level, and other things aren't. If you go so far as to assess for burnout, you then have to address what you find. Listen to your team. They're going to tell you what they need. And then it's your job to advocate for implementing what that need is. What you found, they say this is what we need to help, and then you work to implement that. That's what nurses are looking for. We're not looking for the wave of a magic wand and for healthcare to all of a sudden be different and perfect. We know that that's not possible, but we do want our wellness to be taken seriously. We do want the healthcare system to say we value you in a way that's bigger than sign-on bonuses and gift cards and cups and lunch. We want to be valued in a way that says we care for you as a whole person. And a part of that is understanding that in order to do this work, you have to be well. So address what you find. Number 3, work on a strategy to prevent this. Nurses who are already burnt out, we're past prevention. Now we need to help those nurses recover. But you have new nurses coming into your organization every day, every month. There are new nurses entering, whether they're new grads or they're transplants from one specialty to another, and they've decided that your organization is the best place to be. Helping to prevent burnout is the best way to keep your organization and your nurses well, right? So things that you can look at. 1, approving your nurses' time. Nurses need time off, even in a shortage, even in a pandemic, even in the midst of our organized chaos. Our nurses need time to rest and recharge so that they can get up and do this all over again. Look at what you can do in the area of adding support for your managers. Your managers might need an assistant manager. They might need someone else to help. Look at what your structure is and can you add extra players to the team? How about LPNs? Often our LPNs aren't utilized very well in hospital systems. To relieve some of that stress that's on our nursing staff, adding another layer of nursing staff. That can be a really robust way to create some balance in the days that are really chaotic. Adding some extra team members. Looking at cross training. Right now, we're in dire straits for ICU nurses. We need them like we never have needed them before. But very often, we don't find that nurses are cross-trained well enough to be able to move into other specialties if we have what we've got right now, which is this unexpected pandemic. Looking at things like job sharing. Nurses who've asked for working part-time that you may not have been able to accommodate that, but looking at, can we accommodate that? Can we take that full-time position, turn it into 2 part-time positions, and help a nurse who is really in a place of struggling with some burnout to get a bit of relief? And then finally, looking at hard breaks. Nurses need to take their lunch breaks. They need to take their bathroom breaks and rest breaks. Looking at hard breaks, asking for support staff to come in to help break nurses so that they get their full 30 minutes. They get to use the restroom. Those are some simple things that you can look at right now in your organization to say, hey, can we do any of these to lighten the load? And then looking at what's sustainable. Can some of these things be lasting because they work? All right. And finally, providing. Provide your nurses with the resources that they need in order to stay well in all facets of their life. Looking at offering resilience education to the entire healthcare team, looking at what it really means to be able to up-level your resilience so that when adversity comes, when hard things come, we're able to navigate them differently. Joint Commission has said resilience education for nurses is a must. We have to begin to implement it. Looking at what it really means to implement the kind of resources that nurses need. And I'm not talking about another LMS education where we're clicking through the buttons to get the certificate at the end. I'm talking about real, lasting educational experiences that offer our nurses strategies that they can use now and moving forward. Offering leadership coaches and education to our nurse leaders. Many of us have been in situations where our nurse manager had no formal leadership experience. They had no education. They weren't offered that. It's time to assure that nurses get the leadership that they need, because what we know is that people don't leave the job. We're not leaving the patients. We leave poor leadership. We leave toxic work environments. We leave poor culture. That's why it's so important to check the culture, right? Looking at expanding your benefits package. Often nurses have a education allowance. What if you expanded that education allowance to include wellness retreats? Places where nurses could go and rest, recharge, learn strategies that are personal, but also that they're bringing back to their team on how to stay well. How does that send a message to your nurse that you really care about how they show up and about how they care for themselves? Sends an awesome message. We're willing to expand what we currently do, to add some new things to assure that you are as well as you could possibly be to get up every day and do this job. Our nurses need help now. Leaders are in a very unique position to advocate for that kind of help. In a time such as this, you get to say, this is what's needed. Let's move. Our nurses need our help. Let's give it to them. We've got to stop the bleeding in our healthcare system. Our system depends on it. The lives of our nurses depend on it. And the safety of our patients depend on it. If you are looking for more strategies, you need someone to come in and really help you decide what's happening in your organization and how can we shift that culture to create a culture of resilience, to create a culture of wellness. Connect with me. You can find me at rashidahatchettmedia.com. All things resilience, all things nurses wellness. I am here as a resource. Tap in and remember to check the culture. You can find me next week right here on LinkedIn Live, giving more tips, more strategies for how you maintain wellness as a nurse in your whole life. See you next week.